Hospitals in our area are already pushed to a point where the care of people with non-COVID emergencies is in serious jeopardy. WVTM 13's Chip Scarborough explains why hospitals may not be able to properly care for those in car wrecks or suffering from things like a heart attack.
Alabama is just days away from exceeding the 3,088 hospitalizations the state saw at the height of the pandemic back in January. Right now, 2,430 people are hospitalized with the virus.
And I think we need to recognize that this appears to be the beginning and certainly not the end of our surge with the more transmissible Delta variant.
With one projection showing hospitalizations reaching 7,800 statewide by September 1st, UAB Hospital is preparing for the worst.
If we truly end up with the number of COVID cases that are projected in 2 to 3 weeks, then that means our hospitals are not going to have enough beds to care for these patients. Even if we stop doing everything else, we're just not going to have enough beds.
Forcing hospitals like UAB to transform conference rooms and waiting rooms into COVID units, and forcing doctors to make the most desperate plea yet for vaccinations.
We're trying to prevent people from dying, y'all. I mean, that's just, I don't know how to be more direct and blunt. I don't want people to panic, but I also don't want people to die. I don't want people to have the long-term effects of COVID. And I don't want people to die because our hospital is so full of patients with COVID that we can't take care of your heart attack or your car wreck or your stroke or some other thing.
Our state's fourth surge is largely the result of people choosing not to get vaccinated, actions that are now jeopardizing the health care of people who did.
We're not going to stop the surge. It's already here. But we still can take actions to blunt this surge.
Masking whenever you're around others and getting vaccinated immediately if you haven't already. In Birmingham, Chip Scarborough, WVTM 13.